school season isn't just a reset for the kids. It might be a good time for the rest of us to get our act together too.
Yeah, because we need to.
Yeah.
Here's your warning: between work, family, everything else, it's pretty easy to realize you've been keeping up with everybody else's health but your own. So what checkups and screenings do we actually need? Dr. Natalie Gentile is here to help us figure out our own health to-do list. And you know, it's about time that we start thinking about ourselves a little bit.
I wanted to do this segment to remind myself.
Right. I'm like, who am I? I don't know.
I don't remember.
Yeah.
I don't remember.
Well, it is hard because, I mean, we have tons of screenings for the kids. They need their annual records sent in for the schools. And then we get into it, and it's just so busy that we forget about ourselves. So with summer winding down, what are some of the health priorities we should be looking at for ourselves?
I would definitely recommend checking in with your doc and seeing what screenings you are due for. A lot of the screenings that we have are age-based. So things like mammograms, things like colon cancer screening, these are very much age-based things that you might be due for all of a sudden.
Right.
Also, when was the last time you had your cholesterol checked, your blood sugar checked?
I think last year. I do think I got it done last year. I usually do like a whole panel every year at my physical, but I'm pretty good about doing my annual physical.
I went to the gynecologist this year.
Awesome.
What, is this a big deal for you?
Yeah. That's it. I mean,
I'm like
I
an every
understand.
year
You're
kind of
every
gal.
year.
Oh,
I'm like,
yeah.
it's like I missed a year, but it's because I had a baby, right? And
I
so
just
was
figured
just
back
like,
then I was fine.
check. I was like, check that year. I was great. I mean, they checked everything. It was good to go.
This is real.
It's
This is
true.
very
Yeah.
true.
real.
So if you had to make a priority list, like what should women do first? Like what should be number one?
Specifically women, when are you due for your mammogram? What's key about this is, do you have any family history of breast cancer? Do you have high density breast tissue? These things are going to play into your screening guidelines.
Well, and I didn't realize this too. I scheduled my mammogram last year knowing that I had breast dense tissue, but if you do not tell them that you need the extra ultrasound or whatever it is they want to do, they're just going to schedule you for the mammogram. So you got to make sure that you know that information.
Yeah, and you may also need an MRI. You may need extra or more frequent follow-up. Another one is colon cancer screening. I see so many people say, I don't have any symptoms. I don't want to have that done. I don't want that procedure, so I'm just not going to get it. First of all, the screening age is now 45 years old to start for just average risk people. A lot of people, though, don't realize that they have family members who had polyps that were abnormal. It doesn't have to just be colon cancer itself. So it could be precancerous lesions that make it so your age may go up a little bit earlier, or you have more frequent screening. So that's another one to check in with both your family and with your doc.
If I'm sitting at home right now, I'm thinking, is all of this covered under my insurance? Like, can I get all of these screenings?
For most people who are insured, they have coverage for screening measures that are very much guidelines based.
So based on age,
based
risk
on age,
factors.
risk factors. I mean, a lot of times this takes, work by your doc as well in that office to make sure if you need prior authorizations. Like there's a process behind it. And then we think of our uninsured patients too, because there are a lot of them out there. A lot of people are really having trouble affording insurance, period, nowadays. And so I want them to know as well, you can get screenings done.
Which is kind of what you have your direct care physician. So this is a different type of service. You don't take insurance, you don't use insurance, and people can still get some stuff done through your office.
Yes, and I'm able to navigate those things because I'm very used to the uninsured land, right? Like I take care of insured and uninsured patients both. But uninsured patients can get mammograms, can get colon cancer screening through cash pay or even free programs that are out there to keep up with these screening guidelines.
They exist.
Yes.
You mentioned colon cancer screenings, and that's something where unsymptomatic, you may not say, oh, I need to get this done. What are some other things that you think people skip because they feel healthy at the moment?
Definitely dental work, dental care. Yeah, I mean, there are many people out there who have no dental coverage, and so it's expensive, and they're worried about that, or they're afraid of the dentist. So that would be one I would say keep up with, because your dental health really impacts your entire body's health.
Right.
Yeah, it can really sneak up on you. I'm thinking, are there any of these that we can combine, let's say just in one day? If I'm like, hey, you know what, I'm going to knock 2 birds out with 1 stone
So
today.
instead of like a spa day, you're like, we'll just do the whole...
Yeah.
Or like I say to my couples patients, couples colonoscopy together, schedule it on the same day.
Our producer says that all the time.
It's romantic.
Yeah, it really is.
Yes.
But you have an upcoming event, too, that we want to talk about.
Yeah, so I'm honored to co-chair an event with Adagio Health. They're a regional nonprofit that exists out there to help just these types of patients, people who are needing screening, especially around women's health, people who need STI checks, women and babies, especially their care. And their organization is crucial to our community. So there's an event on September 17th in the evening right over here in Market Square.
Perfect.
Good.
You can sign up. It's called Be Here for Health. You can sign up on Adagio Health website.
You're doing amazing things. And we'll link people up to that, too. And to learn more about direct care physicians of Pittsburgh and Rebel Wellness on our website, go to kdka.com/talkpittsburgh.